Silvia Peregrino, and I'm the host of Entre Nosotras, Latina Voices. I'm also a government professor here at Paso Community College, and today I'm honored to have guests from the Texas Tech University Health Science Center Medical School here in El Paso, Texas. And I want to have our guests introduce themselves, and we'll start with Dr. Jessica Chacon. Welcome.
Hi, thank you so much, Dr. Peregrino, for having us today. My name is Jessica Chacon. I'm an assistant professor at Paul L. Foster School of Medicine at Texas Tech University Health Science Center in El Paso. I teach immunology and microbiology to our medical students. I was born and raised in El Paso. I'm a UTEP graduate, and I received my PhD from MD Anderson, where I was trained as an immunologist. I later conducted my postdoctoral training at University of Pennsylvania in Philadelphia. And then I worked in a pharmaceutical company in Boston before moving back to El Paso almost 2 years ago.
Great, welcome. And you also brought two of your medical school students, so we'll go ahead and have them introduce themselves and tell us where you're from and what year of medical school you're in.
So my name is Kristen Helmsdoerfer, and I'm a first-year student at Paul F. Foster School of Medicine. I'm originally from Columbus, Ohio. I graduated and then moved to Texas 6 years ago, and I used to be a middle school teacher before transitioning to medical school. So I'm delighted to be here in El Paso and here today with you guys.
Hello, I'm Sara Mansour. I'm also a medical student, first year, just like Kristen. I'm from Houston and I was there my whole life. I went to college at College Station and then moved here to El Paso for medical school, and I love it here. Can't believe I'm here. I'm very happy to be here.
Welcome, welcome. We're excited to have you all here. Thank you for taking time out of your busy medical school studies and teaching to join us. And so this is an introductory video to a series that we're going to do regarding COVID-19. And so Dr. Chacon, tell us how the idea to do this series on COVID-19 first came about.
Yes, absolutely. When I moved back to El Paso almost 2 years ago, I knew when I came back home, I wanted to give back to my community. But when the pandemic hit, everybody was sent home. We weren't allowed to engage with others. And I really wanted to use technology to our advantage, and I wanted to help our community, but in a safe manner. So what I did is, if I was feeling like this as a professor, wanting to help my community, but not able to get out there, boots on the ground, I knew that our students who love helping the community felt the same way. So I got this idea to host these different workshops in English and Spanish, but instead of having the faculty be the presenters, I wanted to give our students the opportunity to present to their community. And since everybody had questions about the pandemic, we focus primarily on COVID-19. And so we host various workshops in English and Spanish covering different topics on COVID-19. And then hopefully, once the pandemic is over, we can transition to other health-related topics that affect El Paso.
I know you mentioned earlier that the students were involved in this project. Could you talk about how you're involved, what exactly you're doing?
Yes, so Sara and I are on different teams, and what's great about EP Heat is we have different teams that students can get involved in, so we have a wide range of outreach opportunities. I personally am part of the vaccine team, which is part of these educational online workshops, and so we've given them to a wide range of audiences, anywhere from elementary school students, which was super cute and adorable, to high school students, to college students, and then people in the community. We've also done collaborations with other institutions like UPenn and UT Austin. I know we have some collaborations with Juarez, and getting students from nearby and University of New Mexico and their medical school as well. So it's been really great to be able to talk about COVID in lots of fun different ways, like a true and false format, to get to know more about the vaccine. So I'm primarily involved in the education aspect of it in these workshops.
Yes, and there's also the outreach portion of EP Heat, and that involves us creating COVID-19 informational packages to give out to all the community members. So we've been working, creating those packages from all of our educational materials, putting those into a wonderful bag and a goodie bag with masks and hand sanitizer to give out into the community. So we've done one event doing that. We'll have another one coming up. And we also are working more for outreach. We're getting together some promotoras to help us reach even more people in the El Paso community. So we're doing a lot, and it's very enjoyable.
And Sara, I know you and some of your colleagues did the informational session on COVID, a video that we're going to air later on in the series. Could you talk about whether or not that was for an assignment or if you did that as a volunteer?
Yeah, so that was more so we just wanted to create a shortened version of all of our presentations all into one short presentation, just so everyone can get a nice snippet of it all in one place. And so was all of us came together and said, let's make this. So it was a volunteer opportunity for us. And we had a great time making it, and hopefully the community can watch it and really learn something from it.
Yes, and Kristen, earlier you mentioned EP Heat, which could you tell us what the acronym stands for?
Yes, it's the El Paso Health Education and Awareness Team.
And how did that come about?
Yes, so we first launched our educational workshops back in July. Actually, our first educational workshop was in partnership with El Paso Community College. So we did an entire health fair on a Saturday, and then the following Saturday we did it in Spanish. And then for about a month, I was going back and forth with our team trying to develop names, trying to come up with names, trying to brainstorm names. And I was working on this in the morning while I was drinking coffee, and then late at night before going to bed. And then finally what we did is we involved our students and our faculty. And I said, anybody who has a possible name for us, throw it in the hat and then we'll vote. So it was a consensus as a team where we came up with EP Heat. We wanted to play off the El Paso sun, but we wanted to attribute to where we started, which is El Paso. So we wanted to make sure the El Paso was in there, and then the heat to contribute to the hotness here, and then the health education and awareness team, which is what we're doing.
That's a wonderful name, and I'm glad, I'm thankful as a community member that you all are engaged in this type of work. And so staying on the same train of thought, but kind of doing more educational type questions. The World Health Organization declared COVID-19 a pandemic on March 11th of last year of 2020. So what is a pandemic, and are we still in a pandemic?
So a pandemic is classified when there is a disease present across 3 or more countries. And so, yes, we are definitely still in a pandemic. There are definitely still cases worldwide. And as someone who likes words, I looked up the background of pandemic. Pan means across, endemic means people. So really, pandemic is a disease across people. Unfortunately, that's basically global.
Is it still dangerous in the US?
Yes, it still is, unfortunately. As long as the disease is still here and it's still affecting people, it is considered still dangerous. And that's why more and more people are getting vaccinated to limit this disease spread. And the vaccines are being tested on the variants that have been shown around the world, and it's shown to be effective. So yes, it's still dangerous, but we all need to do our part and become vaccinated to limit the spread of this disease.
And Kristen and Sara, as young people, or as people younger than Dr. Chacon and I, what would you tell young people who feel that they're immune, since this disease is more dangerous for people with pre-existing conditions and older people? What would you tell your peers?
I would say that we are not invincible, and we need to do our part to help out the rest of the community. Children who haven't been able to be vaccinated yet because there's clinical trials going on right now, we need to protect our children. We need to protect our elderly and those that, like you said, are immunocompromised. So even those that have been vaccinated, it's important not to let our guards down, but to continue to follow social distancing guidelines. And I can attest that I personally have been following them. And so I would encourage young people in my age group to continue to be selfless and look out for other people.
a lot of the schools have reopened. How uh, how do you feel about that? You might actually be going back to school as we are in the fall. Is it safe?
So, in terms of safety, it's important that the schools are following their precautions and making sure there's lots of hand sanitizer available, the masks, the appropriate distance, whether that's 3 feet or 6 feet, depending on CDC guidelines in the school district. But as long as schools are adequately and appropriately ensuring that they're followed, then yes, it is safe to send children back to school.
And I'm not a medical professional like you all, but I looked at the New York Times, and they still had El Paso County as very high risk for COVID-19. They in their statistics they said 1 in 6 people in the county have been infected, and 1 out of 328 have died. What's the best way to stay safe from COVID-19?
Well, we've all heard of the 3 Ws: wash your hands, watch your distance, and wear your mask. So those 3 Ws are very important. No matter how long we are staying in this pandemic and fighting to be on our own more, we need to make sure we do these 3 Ws and register for the vaccine as soon as you can. And still, even after you get the vaccine, follow those 3 Ws to limit the spread of the disease.
That's good advice. And so, speaking of vaccines, have any of you had the opportunity to take the vaccine since uh, you're out there in the community doing volunteer work?
Yes, I had the opportunity to get Pfizer in February. So I've had my first and my second dose. And the first dose, I didn't really feel anything except slight soreness in my arm, and it went away. And after my second dose, I felt, some chills for a couple of hours, but afterwards I felt completely fine on the same day.
I had the opportunity to get the Johnson & Johnson or the Janssen vaccine last month. This is a 1 dose. It's not a 2-dose vaccine like the Pfizer or Moderna. And what I felt is a little soreness in my arm that same day. I got it on a Thursday. The Friday, I started to feel chills and body aches, slight feverish. I slept 12 hours straight. And then by Saturday, I was up and about. So for me, it lasted just that Friday, the side effects.
Okay. How about yourself, Sarah?
Yes, so I got Moderna, the 2 doses of Moderna. After the first dose, my arm was a little bit sore, and then the second dose, I also had some arm soreness. I personally did not feel any symptoms, but I know some of my friends did feel the symptoms of fever, headaches, and chills. So, but the process was very quick. I did it at the convention center right here in El Paso. It was so quick, and the process was so easy. It was a great experience.
And that's wonderful. And we didn't even plan it this way, but these are the 3 vaccines that are available in the U.S. And so I myself have also had the Pfizer and was okay, but I'm grateful that we're all here because I think maybe some people have hesitations about taking the vaccine, and you can see that there's some people who have taken it that are doing well and are now protected against uh, getting. You can still get COVID, but you won't get as you won't die. Possibly, is that the benefit of the vaccine?
Yes,
Or
so
you're
they have different efficacies depending whether it's Moderna or Pfizer or Johnson & Johnson, but the vaccines have been 100% or close to 100% effective against preventing deaths and preventing those severe cases that we were seeing.
That's wonderful. But what advice would somebody that has the vaccine, can I just go out and party now? Am I free to go back to normal, or should I still take precautions?
It's very important that we still take precautions. I think what we're seeing right now is just COVID fatigue. I know a lot of people want to know the deadline, the expiration date of the pandemic, and right now we just don't know. We have to take it day by day, and we have to work as a community to overcome this pandemic. So it's still important to take the precautions. As you've seen, all of us have been vaccinated, but we're still following the 3 Ws. We're still watching our distance, wearing our mask, and washing our hands. And for me as a parent, I'm also teaching my young children about this as well. We want to make sure that we have the safety of those who have not been vaccinated or eligible for vaccinations, such as our children. So not only educating them on the 3 Ws, how to stay safe, but also receiving the vaccine so that way they remain protected as well.
And Dr. Chacon, I know you're an expert in immunology. Uh, can you tell us about these COVID variants? Because I know I've been seeing them in the news, and I'm a little worried about uh, those reaching the U.S. And I think some of them have reached some of our other states and maybe Texas as well.
Right. So the way that I teach about viruses and bacteria in the immune system is that our immune system has evolved to protect us against bacteria and viruses. But at the same time, viruses have also evolved to protect themselves against us. And the way that viruses protect themselves is to mutate. And I think Dr. Fauci has mentioned if the virus can't replicate, it doesn't have a chance to mutate. So the variants that we've seen, they're more highly contagious. They can cause more severe diseases. They spread faster and you could get sicker. We should be worried about this, but that gives us even more reason to get vaccinated because some of these vaccines have been tested on the different variants.
So the current vaccine still provides some protections against those variants.
Yes, ma'am.
And so I've known of students that have told me that they've gotten COVID but have recovered, but then still have some lingering effects, like they can't smell, they don't have a sense of taste. Can you talk about some of the COVID long haulers? Is that something that that you're studying, or is it still something that's emerging in the medical field?
So there are still some studies being conducted to get more information regarding that, but it has been noted that every symptom, heart-related or kidney-related or lung-related, that has been affected continues up to 90 days to 9 months in these chronically affected patients.
Is Texas Tech Health Science Center doing any studies on COVID-19 locally?
Yes, we are. There's different categories of research that's being conducted, but one is we're doing a clinical trial, and another one is we're doing what are called retrospective studies, where you look back at patient data and try to learn information to help future patients. And so that's a study that I am currently working on with another professor, another doctor. And we've got some, basic science research. We've got basically a lot of research going on here at Texas Tech, here in El Paso, at a lot of different angles to see what we can learn from this disease to help us moving forward.
And in the next few weeks, we'll be airing some of the videos that the Texas Tech Health Science Center medical students have done. These will be in English and in Spanish. If people have questions after watching these videos, who should they contact?
So we have an email that they can contact, and we'll be happy to respond to them. It's ttuhsc.elpasoheat@gmail.com. And we also have that YouTube page for them to continue to keep watching videos. And if they want to comment, we can try to help out there. But that is ttuhsc_elpaso_heat. They want to look us up on YouTube for even more videos.
Now that we're coming out of our homes and getting back to a new normal, could you talk about some of the upcoming activities that you're planning to do in person? Some of the EP Heat outreach activities?
Yes, so right now we are doing a hybrid model. So we are still continuing to do our virtual workshops. We have a lot of requests for our vaccine workshop, and we do a mental health workshop as well. So we have been partnering with local organizations to provide information that the community needs. But also, we're starting to get our boots on the ground. So our team has been vaccinated, and we've been taking the proper precautions to go out into the community. On March 27th, we were at Food City on Alameda, and we were handing out care packages. And our care packages include hand sanitizer, children's masks, adult masks. We have a COVID-19 informational booklet that our team has developed. This is in English and Spanish. And if I may, we actually developed a children's activity book here. And this is to help educate our children. This is bilingual as well, and that way your children can be informed. Our next event is going to be at Fox Plaza on April 18th, and we will be out there from 8 to 12. But twice a month, we're going to be out in the community. We are trying to partner with various organizations around Texas Tech so that way we could serve the community where our campus is located first, and then we're going to continue to branch out from there.
And so if organizations or businesses wanted your team to go out or to do some of these workshops virtually, uh, would they contact the EP Heat website or just use some of those videos there?
They can do both. We've had a lot of community members, both locally and then nationally, subscribe to our YouTube channel. And then we've had organizations email us. So at the Gmail that Sara has provided, we've had teachers, students, anybody who wants to partner with us, email us, send us their request, and then myself and then our coordinator, Esther Rodriguez, we work closely with the person who has contacted us so that way we can put on a workshop together.
And I know that the coloring book, you can download that as well, right? So parents, if they're still with their kids at home, they could download that coloring book as well.
Absolutely. Our coloring book is 100% free. You can download it as many times as you would like. We can put the link to our webpage so that way parents who are interested can download the children's activity book, and that way they have it for their homes or even students.
And I know Dr. Chacon in January did a workshop for our faculty, so thank you for doing that. I think when people hear from medical professionals, it's better than I guess just hearing rumors. And so I'm thankful to you all for uh, getting the science and dispelling some of the misconceptions around COVID-19. So I thank you for doing that. I'm wondering since you have more outreach with other communities, is El Paso unique in doing this type of project, or are other cities in Texas or in the nation doing something similar?
So we actually were one of the first. We started very early on. Back in May is when I had the idea, and then in July is when we officially launched. So I know we were one of the first, at least in El Paso, to conduct these bilingual workshops. I know that there are other organizations and cities who are providing COVID-19 information, but I think what is unique about EP Heat is that we are bilingual, we're Spanish and English, and it's not the faculty that are presenting, it's our medical students and our graduate students who are given this opportunity to also improve their professional skills as well. What we're doing now is we have other organizations that want to learn how to do this. So we have a train the trainers session where we're training other organizations how to set up their own health education and awareness teams.
We're almost coming up to the end of our show. I'd like to just ask the students, has this been a beneficial experience for you? Do you feel that this doing these workshops, aside from helping the community, has helped you?
Absolutely, hands down. Dr. Chacon has always mentioned, looking back when we are in our 90s and we look back on this pandemic, what did we do and how did we respond? And, we did what we could with what we had during the time. And as she mentioned, it's utilizing technology to reach a wider audience. And I know for me personally, it's a two-way street. By providing these educational workshops, hopefully the audience learns something, but then also it brings me so much joy to hear the responses and the comments, or when people, say things. And so it's really been inspiring for me, and also helped me develop my educational skills as a future physician who will be educating patients. So it has been wonderful in all sorts of aspects, getting to know the community and developing our skills as well.
Definitely. And also getting to meet these community members, even if it's just through WebEx or Zoom or however we're reaching out to them. They're talking, they're asking questions, they're trying to learn more. And you have to learn how to speak to them and hear their story as well. So it's really great time to also get to know other people and to teach yourself how to teach others. So it's been a great experience. Definitely something I'll hope to continue on throughout my years here at El Paso.
Thank you for choosing El Paso as your place to come and study, and we hope I hope to have you as my doctors in the future. And thank you for all that you're doing, medical school, and then volunteering as well. And thank you to Dr. Chacon for taking the lead to for putting this project together. And Dr. Chacon, we'll leave you with the last word.
Thank you so much for having us today. This is a really great opportunity for our institutions to work together. We just want to make sure that people don't get complacent now. We are still fighting this disease. We are still in a pandemic. The end is near and in sight, but we're not there yet. So if we work together as a team, make sure that we do get vaccinated, stay educated, then we'll be okay.
And so you've taught me the 3 W's. Let me see if I remember. Wash my hands. What were the other 2 W's?
Wear your mask.
Wear my mask.
Watch your distance.
And watch my distance. Okay. And so, I'll try to remember the 3 W's. And thank you, ladies, for all that you're doing for El Paso. And hopefully we'll get to meet in real life sometime. But thanks to technology, we're able to do this. And you'll see Sara later on when she's doing the COVID-19 informational video. So thank you for everything you're doing. And thank you, Kristen, for volunteering and organizing. And thank you, Dr. Chacon, for having this wonderful idea. So you're all great, and we're happy to have had you as guests. So thank you for being here.
Thank you for having us.